Life Healthcare was previously known as Afrox Health and relisted on the JSE in June 2010.
Oh, that's ancient history. Since then, they are now growing globally as well, but interestingly not going to the developed world like Switzerland and the UK, but rather entering the market in India and Poland.
Exactly. Market cap here, 40.3 billion rand, PE of 19.9 and a dividend yield of 4.1%. Joseph? Does the story differ when it comes to this stock?
Well, nice dividend yield there, Bronwyn. But secondly, I think as Paul mentioned, they're not going into the advanced or developed world. They're going into emerging markets where I think there is massive disparity between your private and public. And India, 1 billion people. So if they get it right there, I think they've got an opportunity. Obviously, they're doing a catch-up with MedClinic and Netcare to try and make sure they diversify their income and get a little bit of hard currency. Very good management, and obviously went through the troubles and the relisting, and certainly I think they believe that they might be back on their feet now to try and enter into the global market.
Why aren't you excited about this one, Paul? I mean, you give glowing reports where MediClinic and Netcare are concerned, but Life Healthcare doesn't really feature in your thoughts.
I would be very positive about this one too. I mean, it is a big player in the local market. It's got a sort of similar order of magnitude of beds, a little bit less. It's also expanding, also not buying the idea that this is a mature market.
But do you prefer the advanced market story when it comes to healthcare provision to the emerging market play as with Life Healthcare?
I don't know, it's a bit country by country. You know, healthcare is quite tricky because there's a lot of politics around it. So a market like Switzerland is very attractive because everybody's rich. It's compulsory to have healthcare insurance, but there's no caps on the amount you're allowed to charge people when they're in hospital. So
and everybody wants to live forever.
And exactly, and they can afford, all sorts of advanced therapies and injections and life-saving oncology treatments when they're on their last legs and so on. That's what you want. You don't want a market where there's a lot of government intervention, there's a lot of price control and regulation. So you've got to pick and choose, I think. But South Africa, it happens.
Before we go further,
a very good
let's have a look at the share price graph. There we go. This is not looking bad by comparison. There's definitely a strong uptick at the close there.
Yeah, and that's reflective of the overall market, I guess, which has recovered. So these stocks are getting a bit of a bid as well.
I mean, the graphs look almost the same, really, that from 2015 they were coming down, and all of a sudden now, they kind of reached a floor or a trough where they're looking to be able to pick up again.
In terms of expansion in the South African market, they're continuing to invest in more beds in the renal dialysis area. That's interesting. They've got quite a big focus at some of their Durban hospitals on mental health for some reason. They're talking about beds that they're adding for mental health patients. And just generally infill acquisitions, some of the smaller centers like Joseph mentioned earlier.
Let's go to hot or not. Can we go to hot or not? Is there something else you want to put in there?
We've mentioned India. I don't know what's going on with Poland, because you'll remember that Poland, we've also got our property companies expanding in there. So I don't know what it is about the business people in Poland.
I think we should do some analysis on Poland, as a destination for retail and for healthcare.
I think we should send you there to do some on-the-ground investigation.
Right, I take up that challenge. Hot or not on Life Healthcare? Hot, Paul, hot or not?
Yeah, I like them a lot. I think just generally this sector deserves higher multiples than it currently trades on. So hot on that one too.